This next exercise is VOR cancellation, or vestibular ocular reflex cancellation. So the most common exercises we're going to do are going to be smooth pursuits, that's eyes tracking a moving object, saccades, where eyes are moving between two targets, VOR, which is where the target stays still and our head moves, at least in that VOR times 1, and then VOR cancellation, where the head and the target move in sync with each other. So the pen is always right in front of my nose, it's just where's my nose pointing, right? Head's turning over top of the body there. So typically this one, when we test it standing. We kind of use both hands and rotate through a big range of motion. This one doesn't run into the range of motion limitation that the VOR does, because the target is always right in the middle of your vision. So if I wanted to move through a big arc of motion, as long as I have the upper back and lower back, neck mobility, well, really not neck mobility, just upper and lower back mobility, then I can do this task, okay? Sitting, back supported is going to be your most friendly position to start in. We can do horizontal. We could even do vertical if we kind of involve the head and the upper body a little bit, upper back and head and neck into it. But more commonly described horizontally, okay? We don't want this to make your symptoms way worse. You want to be able to maintain clear vision on that target if you can. If you start to lose, it gets blurry, you get more headache, you get more nausea, dizziness, fogginess, anything like that. Those are all symptoms that we want to manage. Generally speaking, we'll talk about it more individually in each person's visit, but generally speaking, we only want a very small increase in symptoms that only lasts a short amount of time, okay? And then by the time you're done, within a minute or two of finishing your exercises, you can go back about your day normal, at least as normal as it was before you started the exercise, okay? So that is just that target is up in front of you, holding on to something, and then you're moving that head along with the target, okay? Smaller arc of motion is going to be easier. Clear background, like the wall in front of me, not the light that I'm staring into, that's going to be better. Busy background, like a checkerboard or something like that, you know, if that's right in the middle of your visual field, that's going to be a little bit less friendly. Bigger checkerboard will be a little bit easier. So those are all sorts of different options. Now you can also do this standing, right? Stand up. A lot of people find that starting with both hands in front makes it a little bit easier to follow the target with your body, because then you just kind of keep your shoulders locked and you can move. But you can by all means do it with one arm as well, as long as you got the coordination for it, okay? This one's usually described a lot slower because it's a bigger arc of motion than the VOR. So don't do it at this speed. Don't try to like give yourself whiplash turning really quickly side to side. Just, you know, that sort of speed. So we're thinking like maybe here would be about as fast as you probably need to do it, okay? That's that VOR cancellation.